Good morning. My name's Gary Sawatzky. Welcome to the webinar. I am the Chief Operating Officer for the Alberta Retired Teachers Association. Joining me today is Amanda Shaw, ARTA CIO, the ARTA Senior Member Services Administrators, Joanne Brewer, Morgan Bond, Vivian Luca, and Densi Baiju. And as well, we're going to have our Director of Pharmacy Services, Yatin Patel, join us as well. He's just coming in from another meeting and will be joining in a minute. I'm going to talk to you today about a number of things with regard to the benefits plan. But first, let's go through some parking lot items. The first is this session is going to be recorded and it is going to be posted on ARTA's YouTube channel. So if you want to go back, you want to watch it again, please do so. The ARTA channel is available on YouTube with a quick search. We have a lot of great information on there, and I definitely encourage you to go there. Your video and microphone have been disabled for your privacy. That way, if you have any questions, please use the Q&A function in Zoom. Do not use the chat box. There is a button, it's called Q&A. Please ask any of your questions there. The reason we have our senior administrators and director of pharmacy services with us today is to answer those questions that may come up as we go through our presentation. We're going to look at prescription drug experience specifically for the ARTA Benefits Plan, as well as some general health and dental claims experience. You can see where the plan has been going over the past year and a bit. We'll talk about the plan changes that are going to be upcoming starting November 1st, as well as the monthly rate changes that are going to be effective November 1st. And you'll see those rate changes come out of your bank account on November 10th. So you'll definitely notice a change at that time. So moving on to the prescription drug experience for the education sector, looking at calendar year 2024, we can see that the number one item claimed through pharmacies are the Freestyle Libre sensors. If you're not familiar with those, they are little discs that go on the back of your arm, and they allow you to read your blood glucose levels in real time. You can use your phone or a special reader, and that lets you track changes in your blood glucose levels continuously. We currently cover them for people who are insulin dependent, so insulin dependent diabetics. And last year, 2024, we spent almost $600,000 in the education sector for those sensors. The number two item was Arexvy. That is the RSV vaccine. And this really came on in late 2023. Overall, in the plan, we spent $2.2 million on the RSV vaccine Arexvy. That does seem like a lot of money. And yes, I also believe the government should have been covering those. Thankfully, a lot of them are having their coverage now for Arexvy. Some people do qualify for it through government programs. And so that claim amount has dropped off. Looking at the $2.2 million, we didn't see it as a cost. We saw it as an investment in our members' health. If we can keep them healthy, then they come out ahead in the end. Number three was Shingrix, another vaccine. About 60% of our members have received at least one dose of Shingrix, and that's another good preventative measure for our members. We don't want our members getting shingles. It's very debilitating. Therefore, we're quite happy to cover that vaccine, even though our governments are not covering for our members. Number four, Ozempic. We're all very familiar with Ozempic. We've heard about it in the news. It's a very popular medication, and I'll talk more about that in a minute. Number five was rosuvastatin, which is a cholesterol maintenance medication. Looking down below at the top 10 drugs by number of claims, we can see rosuvastatin was number one. And that's really why it was included in the top 10 list by dollars spent in the chart above, is simply because so many people are taking rosuvastatin to treat their cholesterol issues. Looking at the top 10 list by number of claims for the education sector in 2024, we see that every single one of these medications is for a maintenance issue. So obviously maintenance medications, people take them every day. They get them at 90 or 100-day supply at a time. So all of those top 10 drugs are maintenance medications. Things have changed a little bit for 2025. Looking at the year-to-date experience up to the end of September, we can see that Shingrix, the shingles vaccine, has moved back up to number one. It's a very popular medication. Obviously, it was the number one medication for a few years before Arexvy. More people are getting the shingles vaccine, which is certainly encouraged. The Freestyle Libre sensor has moved down to number two. And we predict that we're going to spend about $200,000 less in 2025 than we did in 2024 for the Freestyle Libre sensors. The reason for that is there's now some government coverage for Freestyle Libre sensors. Their coverage is much more stringent than ours. You do have to qualify for it to get coverage through the Coverage for Seniors plan, but it has helped to offset some of the costs that we're seeing for those devices. Number three is a very new medication. Last November 1st, we started covering weight loss medications as a part of our basic extended healthcare coverage. The number three drug, Wegovy, falls under that category. Wegovy and Ozempic, the number four medication, are very interesting because they share the same medicinal ingredient. It's called semaglutide. And semaglutide is going to have a little bit of a journey in 2026 because Novo Nordisk, the manufacturers of Wegovy and Ozempic, have lost their patent protection for semaglutide as of the end of 2025. And so far, there are already two generic drug manufacturers who have indicated that they are going to start producing generic forms of Wegovy and Ozempic in early 2026. This is a great thing for us because generic costs are anywhere between 18 and 75% of the cost of the brand name medication. It's all dependent on the number of generic drug manufacturers who are making that particular drug. So the more manufacturers that are picking up and releasing generic versions of Wegovy or Ozempic, the cheaper those generic drugs are going to cost, and it will help with our bottom line in the long term. Other than that, there's a lot of the same medications in the top 10 list for the education sector as we saw in 2024, except for Wegovy. That one is new. The top 10 drugs by number of claims is the exact same list and same order that we saw in 2024. For the public and private sector claims experience, we can see the Freestyle Libre sensor was number one, followed by the RSV vaccine, followed by Ozempic, Shingrix, Vagifem, a lot of the same medications that we saw in the education sector, which obviously makes a lot of sense. The same goes with the top 10 list by number of claims for the public and private sector in 2024. This changes considerably for 2025, however. You can see that Wegovy was the number one drug claimed by the public and private sector members in 2025 so far. Almost $270,000 worth of Wegovy has been claimed, followed by Ozempic, then Shingrix, and that Freestyle Libre sensor. In the public and private sector, we think we're going to save about $100,000 because the government is picking up some of the costs for the Freestyle Libre sensor. So all the power to them. The top 10 list, again, the exact same list as we saw for the public and private sector in 2024. And looking at the claims experience, this is a chart of the education sector extended healthcare expenses from 2020 to 2025. The green line gives the net loss ratio. So that is all of the overhead expenses have been removed already from these numbers, and we just follow the green line. 2020 and 2021, we can see that we were well below 100%. At 100% loss ratio, that means that every dollar being paid into the plan is spent in claims. If it's under 100%, that means we have more premium deposits coming in than we're paying out in claims. And if it's over 100%, that means we're paying out more in claims than we're bringing in premium deposits. Obviously not sustainable in the long term. But we've always made the commitment to our members that in times of good experience, we will reduce rates. And we did just that in 2020 and 2021. We had fairly hefty rate decreases in each of those years. Obviously, we know what was going on in those years. We had a pandemic. As a result, people were not going for things like massages or seeing their chiropractor. And so claims came down quite a bit, and we were able to reduce those rates. Since that time, people are making up for lost time. And so we saw increases in extended healthcare claims, along with increases in the consumer price index for those types of services. So inflationary pressures have really hit the plan hard in the past couple of years. We've had to increase the rates for the past few years, but we always strive to keep rates as steady as possible. We want to keep that loss ratio around 100%. You can see in 2025, so far, we've been pretty successful at it, to the point that we were going to be able to keep rates steady this year until the government came around. I mentioned that they are starting to cover some Freestyle Libre sensors. That's helping out with our overall costs. And then they announced in the spring that they were making changes to the coverage for seniors plan, specifically for prescription drugs. They announced this spring that they were going to increase the copay amount, that is the amount paid for out of pocket by seniors in Alberta, from $25 to $35. If you have coverage for seniors, chances are ARTA is picking up those costs and you're not seeing any of it. So you effectively get 100% coverage. But that means our costs are going up to the tune of about 3.7% for the 2026 experience year. So as a result, we've had to factor that into our annual rate increase for the upcoming year. Dental care is quite a bit different. Dental care is what keeps me awake at night. You can see the claims going back to 2020, again, when there was a pandemic, when people didn't want other people sticking their fingers in their mouths, claims came down quite a bit. During that time, we had 2 months where we had virtually no claims for dental care. So again, we were able to decrease the rates in 2020 by quite a bit, by 9.3% at that time. But since then, there have been some drastic changes in the dental care marketplace, and charges have gone up very considerably. You can see in 2020, our claims were only $10.5 million. In 2024, they were $21.7 million. So more than doubling in that 4-year period. I'd say about 20% of that is due to growth in people covered under the ARTA plan. The other 80% is simply increases in marketplace charges. So huge increases. In 2023, you can see we were running at a 125% loss ratio. That meant for every dollar that was paid in premium, we were spending $1.25 in claims because of those higher claim amounts. So obviously that is not sustainable. We had to increase the rates quite a bit in 2023, quite a bit more in 2024. This year, we're finally down to single-digit increases, and it's looking better than it has in the past. But we're still having to put in that increase because, as you see, we're still running at about 105% loss ratio. So still paying out way more in claims than we're bringing in premiums, resulting in that rate increase. Looking at the public and private sector, fairly similar increases that we've seen in the education sector. The premiums and claims are going up a little higher, at a higher rate than we saw in the education sector, but we also have greater growth in the public and private sector. So growth accounts for more of those increases in this sector. But looking at those rates, the average rate increase since 2012 has been 2.6%. So we have had some increases in the past few years, but overall, when we draw it out over the longer term, the rate increases have not been that bad on an annual basis. We do always try to keep those rates steady. But again, the dental care experience has exploded in the public and private sector as well. We saw back in 2022 and 2023, we were running about 120% loss ratio. Again, not sustainable. And as a result, we have had to increase those rates just to try to keep up with the inflationary pressures for dental care. This is certainly not just happening within ARTA, it is happening in the marketplace as a whole. The average increase in 2023 based on the industry was 35% increase in rates at that time. So we're simply being caught up in that. Looking at their claims in the public and private sector as well, we can see we had $4.1 million in claims in 2020. That increased to $10.8 million in claims. So 2.5 times higher claims in 2024 than we had back in 2020. Looking at some of the plan changes that we're making for the upcoming year, we do a study every year where we look at the number of people who hit their prescription drug maximums. In 2023, only 1.3% of our members actually reached their prescription drug maximum. So we make sure that the maximums make sense for the upcoming year. In 2024, however, that changed quite a bit. About 5.5% of the people reached their prescription drug maximum. So as a result, the Health Benefits Committee and the ARTA Board of Directors elected to increase the maximums for the Build Your Own plans. So if you had a $1,200 maximum before November 1st, that's going up to $1,500 per year. If you had a $2,000 drug maximum, that's increasing to $2,500 starting November 1st. And those effects go in at November 1st. So if you've already reached your $1,200 maximum, starting November 1st to December 31st, you'll have an additional $300 to spend for prescription drugs. And with the $2,000 maximum, that's going up to $2,500. So you'll have $500 extra to pay for prescription drugs between November 1st and December 31st. We're adding coverage for biofeedback devices for pelvic floor treatment. That's being added to the same triennial maximum that we have for pessaries. We're increasing incontinence supplies from $200 per year up to $800 per year starting November 1st. The emergency travel maximum benefit is increasing from $5 million lifetime to $5 million per trip. So if you've had to make some claims for emergency travel and you were worried about hitting that lifetime maximum, you don't need to worry about that anymore. We're having a per trip maximum instead of a lifetime maximum. The usual and customary charges are being increased for 6 paramedical practitioner services. This is something I'm really proud of that we do at ARTA. We look at what's happening in the industry, and if the usual and customary charges need to be changed, we change them. That is very unique. Most benefit plans will implement their UNC charges at the beginning when the plan is rolled out, and then they're never touched again. They stay static, whereas we change them based on the marketplace. And this is really important if you are looking at any other benefit plans. Always make sure you're reading the fine print. There are some benefit plans out there who say that they cover 100% of eligible expenses, but then when you read the fine print, you see that they have inside limits that never allow you to reach that 100% coverage. For example, they may say that they have 100% coverage for massage therapy, but they base their per visit charge on a $75 charge. And so if your massage therapist is charging $130 for a massage, with that other plan, you're only going to get $75 back in your pocket. With our plan, you're going to get $105 back in your pocket. So even though we have 80% coverage, we have higher per visit maximums and therefore pay out more than some of those competitive plans. So always read the fine print. And finally, we're making another change to the emergency travel. If you are traveling and you need the services of a physiotherapist, chiropractor, or a chiropodist/podiatrist, the maximum amounts is increasing from $250 per practitioner per year to $500 per practitioner per year. And looking at the rate updates starting November 1st. If you're in the education sector and you're covered for extended healthcare with travel, that's going up by 5.1% starting November 1st. If you don't have travel included, it's going up by 3.7%. Again, that 3.7% is exactly the amount that's been downloaded to our plan from the decreased coverage in the Coverage for Seniors plan in Alberta. If you have dental care, those are going up by 9.5%. In the public and private sector, if you have extended healthcare with travel, it's going up by 7.5%, without travel by 6.7%. Their experience was not quite as good, so the rate increases are a little bit higher. But the opposite is true of dental care. Their experience is a little bit better than the education sector, so their rates are going up by 7.2%. And that's it for the updates at November 1st. We do have a lot of people on the line and we are open to questions. That being said, if you're not able to get your questions answered today, please send them in to info@arta.net or give us a call, 855-444-2782, and we would be pleased to answer any of the questions that you may have after this presentation.
Gary, can you speak to why prescription coverage is mandatory and built into all ARTA benefit plans?
You bet. Prescription drugs is one of those things that we do include coverage for primarily because it is the number one thing claimed under our plan. It's even though we have coverage for seniors, other provinces have other coverage available as well. We always recognize that there's going to be some prescription drug costs for virtually all of our members. There are a handful of members who don't make prescription drug claims throughout the year, especially given the cohort age of our members. Most people are on some type of medications, typically maintenance medications, as we saw in the experience. And therefore, just like every other benefit plan out there, we include prescription drug coverage in our plan as well.
Our favorite topic around the office lately, can you or Yatin speak to the COVID vaccine, the differences between getting it through the public health program or a private pharmacy, and how those costs are covered by the ARTA benefit plans?
You bet. I'm going to turn that over to Yatin.
Hi, sorry. Yeah, I can speak to the COVID vaccination coverage change. This was effective during the summer Alberta announcements that the Alberta Health or Primary Preventative Care was going to be taking over supply of COVID vaccinations. So coverage, depending on which phase individuals fall under the public criteria for covered under the Alberta Health Insurance Plan versus not covered by Alberta Health Insurance Plan. So there's a list of criteria that are listed on the government website, whether you fall under their phase 1, which would be covered, or phase 2, which would be an administration cost of $100. That's for the publicly funded supply of COVID. There is private supply of COVID vaccination as well. That is covered by ARTA, but is subject to your space under your prescription plan maximum. The cost of that private supply would be about $130 from a typical pharmacy, and there may be an administration cost to provide that vaccination of $20 that is not covered under your ARTA coverage. So I hope that addresses the question. For individuals that are looking for support of whether they qualify under the public supply, they can look to 811 as a phone number, or in the meeting notes here, we can provide a link to the Alberta vaccine booking system, which provides some oversight or information about qualification. The members can also look to a recent ARTA Scripts article that is posted on our website for guidance on how to find COVID vaccine.
Yatin, does ARTA advocate for Novavax for those of us who cannot get the mRNA vaccine?
Advocate in the sense of ARTA did express concerns about COVID vaccination in general, access to seniors. We did send a letter. We didn't make it product specific, specifically just talking about publicly funded vaccinations. So I might take that question offline if there's specific concerns about the type of vaccine you're looking for. And I see there's a question about COVID shots at the pharmacy. If you have submitted your claim from the pharmacy, there was some concern about, there was a formulation change with COVID vaccination. So now instead of a multi-dose vial, it's a single dose preloaded syringe. So there had taken some time for that product to be listed with Green Shield. So I would suggest resubmitting those receipts or getting in touch with member services for management of those receipts, but they should be eligible at this point.
And so for those of us classified under the phase 2 rollout with that $100 administration fee, can you explain how much of that charge will be covered by their ARTA benefit plan?
It's a great question. There's still a little bit of uncertainty about what these receipts will look like and how they will be provided to Albertans. My understanding is that there won't be actually any funds that are taken at the site of administration, but rather an electronic payment submission through your My Alberta Health records. So we are hopeful that once you pay that invoice or receipt, you'll be issued a receipt, and that can be sent to member services. Until we get some real experience with what those receipts look like, they will need some special handling, but we have been working with Green Shield Canada to ensure that those claims are properly paid.
I do see a question regarding the inflationary rate of 1.7%. That is for all products across Canada, 1.7%, but as you're likely aware, medical costs typically are higher than the regular consumer price index. And as I said, we base the rates on the experience, so actual claims being made by our members. And so we set the rates. It's not an insurance company that sets the rates. And we can only base it on the amount of expected claims that our members are going to make for the upcoming year. So unfortunately, we can't tie it directly to CPI because that would not be sustainable in the long term. We self-insure, and therefore we can set the rates, but we always set them appropriately to pay for the claims that are expected. There's another question here. Has any thought been given to per couple maximums for extended healthcare and dental? We have looked into that, but it would be a 15% rate increase across the board, because often we see in a couple, one person makes a lot of claims, the other one doesn't make any at all. If you were sharing those maximums, that would be a net increase in claims and therefore a 15% rate increase. So we thought that that's a little more than our members could tolerate just by making that one combined maximum change. Therefore, we did not implement that.
There's been a couple of questions about the Calgary pharmacy and when that's opening. Do you want to speak to that?
Yeah, I can speak to that. So currently we are working with the Alberta College of Pharmacy on our licensing process. Unfortunately, this is not a quick process, and it requires can be some back and forth with the college. But as far as we are actively engaged with the college, our license Submission has been sent. We're just awaiting a response from the college and a planned physical inspection. Once that's completed, essentially, we will be ready to be opening the doors. But again, the timeline is kind of at the mercy of the regulatory office at this point. But we're hopeful in the next 2 months, but don't quote me on that timeline. Again, it's kind of out of our control. We've submitted all the information that's required. But we're just waiting to continue to collaborate with the college.
Yeah, and there's also a follow-up question about how is the pharmacy working in Edmonton? Is it working well?
And my thoughts are yes. We've seen membership grow quite substantially for the plans associated with the pharmacy. Most recent count was just under 3,500 members that are utilizing the pharmacy. Not all of those members will have prescription need, but the vast majority will. We've been able to provide product advice, pharmaceutical care to the clients, really trying to push for that in-person care component, but in support of that, able to offer virtual consultations, delivery. We're doing a lot of travel vaccinations because our clients are very actively engaged in travel. So I think that's a great benefit. Vaccination services in general. On October 20th, we'll be starting up our public influenza campaign, and we are fully booked over the next 3 weeks. So it's a great sign to see. So yeah, I think it's going quite well.
Gary, do you want to talk about if there were any changes to the supplemental travel insurance this year?
The same coverage applies to supplemental travel that we saw in the base extended healthcare amounts. So therefore, they have the higher $5 million maximum per trip, as well as the higher paramedical practitioner coverage. The rates are changing slightly. I think it's about 2%, maybe 2.5% increase, but that's the only change to supplemental travel.
Thank you. Yatin, do you want to speak to what snowbirds can do to get their prescriptions from ARTA RX while they're out of country or in advance before they leave?
Yeah, that's a great question and a common one that we see at the pharmacy. Unfortunately, we're not able to deliver medications outside of Canada. So if you are needing to have vacation supply, it's best to plan prior to your departure date. Most of our clients over the age of 65 will need to coordinate with the Alberta Seniors Plan. So it's ideal a couple of weeks in advance of leaving to contact the pharmacy. We will need valid prescription when that the doctor or the prescriber allocates for that travel supply. The pharmacy can do the adjudication or legwork to ensure that coverage is there for those times. Essentially, they'll need the date of departure and the date of return. The maximum day supply, I think, is 200 days or 212 days that we can provide coverage for. Outside of that, it becomes an out-of-pocket expense. And those medications have had to have been used previously. Otherwise, there are exceptions that the pharmacy can work through to ensure that you have supply. So I hope that answers the question. Unfortunately, we cannot ship to out of country. So if you've already departed, the pharmacy won't be able to provide supply to you.
When the Calgary pharmacy opens, will Calgarians be required to switch their prescription over to the Calgary pharmacy, or can they continue with their current pharmacy?
It's a great question, and it really depends on the type of plan that you've chosen. When we're planning ARTA RX Pharmacy and the plans associated with it, we wanted to ensure that there was choice for our clients, understanding that some of our clients have a good relationship with their existing pharmacy. And so if you have one of the plans that is not requiring utilization of an ARTA RX Pharmacy, you can continue with that your existing pharmacy vendor. But if you've chosen one of the plans associated with ARTA RX Pharmacy, I think that's Complete Health and Total Health RX.
Complete Health and HealthWise RX.
HealthWise, thank you. HealthWise RX. If you've chosen one of those two plans, then you've kind of made that commitment to utilizing the pharmacy ARTA RX. And the idea behind that is that we're able to generate some revenue through the pharmacy, and that revenue goes, as the whole owner of the pharmacy is ARTA, all that revenue goes back into the plan to improve premiums or stabilize premiums and improve coverage levels. So it depends on the type of plan that you've purchased, whether you will need to transfer your prescriptions to the ARTA RX pharmacy in Calgary when it opens. There will be communication. We've planned communication to those members that will be affected once the pharmacy is open and operational.
And just to further clarify, all of our members, the majority of our members in the Calgary area are currently enrolled on plans that do not have any allegiance with the RX pharmacy. So if you wanted to stay with your current pharmacy, you would have to make no changes to your benefit plan, and you could just continue to do so. But if you'd like to switch once the Calgary pharmacy opens to take advantage of those special plans in conjunction with the pharmacy, you'd have to contact our office and make that change.
I might speak to the question here about phase 2, the $100 charge for COVID, the administration charge. This charge would be covered by ARTA, as would the private supply would be covered if you're getting it administered by a community pharmacy. There is a cost difference between the two supplies. The publicly funded supply that is an out-of-pocket charge, that $100 is eligible, but we just don't have a receipt experience with Alberta Primary and Preventative Care. So we don't know what that receipt will look like. And so we're working with Green Shield Canada to ensure that that process is smooth and is being paid for, but it would be a pay and submit experience. Through the pharmacies, we are again working with Green Shield Canada to ensure that there is a direct billing option, but what may not be covered is the administration cost that the pharmacies provide in providing that vaccine. So the vaccine product supply will be covered, but the administration cost may not be covered. So I hope that clarifies that question.
Gary, the Canadian Dental Plan has come up a couple times. Do you want to address that live?
You bet. The Canadian Dental Care Plan eligibility is a bit of a moving target. When it was first rolled out, they indicated that if you have access to a private dental care plan, that you would not qualify for the CDCP. As a result, anybody who was an ARTA member who applied for CDCP, if they indicated that they simply had access to the plan, they would not qualify for coverage under the CDCP. Since that time, their wording has softened a little bit. So if you do qualify for CDCP, there are a number of qualifications, especially around your annual family income. Even if you have ARTA plan, or even if you don't have the ARTA plan but have access to it, we found that people are now eligible for CDCP coverage. Simply having access to the ARTA plan is not going to preclude them from coverage through the public plan.
Gary, there's been a question about the 24-month period of being in a dental care plan. Can you maybe go through that?
Yeah, you bet. We do have a 24-month lock-in period for dental care, simply to prevent against selection against the plan. We don't want somebody coming into the dental care plan, racking up all of their bills, hitting all of their maximums over the course of 1 month, and then leaving the plan, because it is a fully member paid for plan. And that wouldn't be fair to all of the other members. So as a result, to prevent against selection against the plan, we do have that 2-year lock-in period for dental care. There's a question, will the increase in travel supplementary insurance be posted? Yes, we're working on the rate sheets right now. They're effective November 1st, but they're going to be going up very soon.
Can you also talk about those lock-in periods for other coverage areas, specifically extended healthcare plans?
You bet. The way the plan is set up right now, if you increase your coverage, say you move from the new $1,500 maximum up to $2,500, you are going to be locked into that amount for 2 years for the same reasons as we see in dental care. We don't want somebody coming in, racking up $1,000 worth of prescription drugs over the course of a month, and then moving their maximum amounts back down. It's not fair to the other members who are already paying those higher amounts. Therefore, we have that 2-year lock-in period.
And if you're past that lock-in period of 2 years, can you terminate or change your coverage at any time?
You absolutely can. You just need to let us know in writing.
What exactly do you mean by lock-in period?
The lock-in period is the amount of time you need to spend within that particular benefit plan. So for example, if you take dental care, you are expected to participate in the dental care plan for 24 months before you can reduce your coverage or terminate your coverage in that plan.
Are the new premium rate sheets posted for all of the plans effective November in case you want to make changes based on the premiums?
Yes,
Jen,
they
do you
have been
yes.
posted. Almost all of the rate sheets have been posted. We have a lot of rate sheets, but the big ones have been posted. These are some great questions. Thank you to our members.
Yeah, and do you want to answer, are we any further along on getting the ARTA RX for areas outside Edmonton or Calgary?
Yeah, it's a great question. So thanks for submitting that. At this point, we have ARTA has attempted to engage with government officials, pharmacy regulatory groups on providing care on a virtual platform. Now, Alberta has taken a very different approach than many of the other provinces in Canada on virtual care and mail order service. So we continue to push this envelope, recognizing where we are in accessibility to health providers and affordable prescription products. So we continue to engage, but there hasn't been much traction on moving forward in those areas. Now, what ARTA's done, I suppose, in other avenues is working with Green Shield. Our members have access to telemedicine or telehealth, so that's getting them in contact with prescribers virtually on a platform, on a safe and secure platform. And then if there are prescriptions that become a result of that consultation, they can be directed to any local pharmacy. But as far as ARTA RX mail order service, we continue to have that engagement, but there hasn't been any meaningful progress moving forward. But with the expansion of ARTA RX South into the Calgary area, there may be opportunities to look at other ways to support members outside of these two major hubs. So stay tuned. There's another one, Amanda, about the COVID administration fees. And I appreciate the questions for sure. There's definitely a lot of moving parts to this, and it is a new venture for Alberta Health to provide COVID vaccinations or vaccinations in general that they're charging an out-of-pocket cost for. So as I stated, this is a new experience for Alberta and the primary and preventative care. There was not a lot of information provided to pharmacies nor private payer plans about what this would look like. Essentially, what we've heard through our consultations is that at those immunization centers, clients will be assessed whether they fall within phase 1 of the program, which would be eligible for a no out-of-pocket cost for the COVID vaccination, or phase 2, where there would be an out-of-pocket cost of $100. What that cost or how payment is going to be collected for that $100 has been uncertain. We were speculating that there may be a point of sale where they would collect it at the immunization center, but that's not the experience that our members have been seeing. There is an electronic claims invoice that's being sent to our clients, and payment of that invoice would result in a receipt. That receipt can be provided to ARTA, either on your My ARTA Health Hub, where you would submit any other paper claim receipt. and that would be processed and paid subject to space under your prescription plan maximum amount and the details of prescription coverage as well. I hope that addresses that.
There is a great question too about what's displayed on your benefits ID card with those changes in plan maximums. So all of our members will be receiving new benefit ID cards in the mail that are reflective of those new prescription drug maximums. With the Canada Post strike, those were a little bit delayed in being sent out, but they are en route now. You can also download an updated card after November 1st. Before November 1st, on my ARTA, it will still be showing those old plan maximums. Those will be updated on November 1st, and you can download a copy there as well. Your benefit ID number itself hasn't changed, so you don't need to take any further action if you already have your benefit ID card on file with providers who direct bill. They'll still be able to continue direct bill and access those new maximums. But we know it's always nice having that tangible reminder in that benefit ID card. So those new cards are in the mail and on their way to our members.
Just going through some of the final questions that the members have been asking. If you do still have a question, we still have time. If you'd like to use the Q&A function, please do so.
Gary, was physio one of the paramedical practitioners that had an increase?
It is. Physiotherapy treatment has increased starting November 1st, the per visit maximums.
There's also a great question about if you're in the Calgary area, can we sign up for the RX plans in Calgary now? You do have to wait until we have our pharmacy license, but as soon as we have that, we promise we'll be sending out information to those of you in the Calgary area. Gary, do you want to talk about annual eye examinations and the coverage under ARTA? That's been asked a couple of times.
Will do. In Alberta, you may have heard that the government is no longer covering follow-up eye examinations for seniors. It is, however, still covering the eye examinations, the full eye examinations for seniors. We looked into it, and it was not something that the Health Benefits Committee felt was important to do the follow-up exams. And with the government still covering the full eye examinations, we elected to not add that additional follow-up exam under the coverage for vision care this year. There's a question regarding the increase in the total paramedical practitioner annual limit. No, it was increased about 5 or 6 years ago. We have not increased that at this time. So even though the per visit maximums have increased for 6 paramedical practitioners, the annual maximums have not increased this year.
Does ARTA cover hearing tests?
We do. We cover hearing tests when provided by an audiologist, a hearing aid practitioner. Those are already covered. There's also a question regarding some out-of-pocket costs for eye exams. Some optometrists we've heard in the marketplace have started to charge in excess of what the government is paying. The government sets an annual amount that they'll pay for eye exams. Some optometrists in the marketplace have taken it upon themselves to charge an additional amount out of pocket that they expect the patient will be covering. My suggestion is to shop around, just like anything else, just like dental care, just like buying a car, anything. Shop around and perhaps look for an optometrist who is still charging based on what the government charges. There's a question regarding, is ARTA covering paramedical services, such as monitoring a person overnight in their home, but not requiring an RN? I'm not quite sure what type of paramedical practitioner would be doing that. If you could be a little more specific in your question. We obviously do cover home nursing, but I'm not sure what type of paramedical service specifically you are requesting.
There's a question about doing this presentation more than twice a year. This one's really focused on all the changes that are upcoming on November 1st, but Jen Hope, who's our Director of Marketing and on this call, does a presentation on the benefits plan every single month. You can find a link to register for that on arta.net on the events calendar. And so if you ever just need a refresher on what your coverage includes, you're more than welcome to join that presentation. And it's her favorite thing to do each month. So.
I will add a link in the chat to let you know when the next one is.
We had a question regarding ambulance services. Yes, ambulances are covered if you're under age 65. In Alberta, if you're 65 and over, those are covered by the Coverage for Seniors plan.
Well, Gary, there's the clarification on the previous question that a healthcare aide would be coming into a home.
A healthcare aide is not covered. It's not a practitioner covered by the ARTA Benefits Plan. I see there's a couple good Yatin questions in the chat as well, so I'll let him finish typing his current answer before he gets to the Nova Rapid Insulin question.
So regarding the Nova Rapid Insulin question, so more recently the product has been made eligible or subject to the biosimilar product. So there is a biosimilar product available on the market. Coverage has moved towards the biosimilar product with a few exceptions. The exceptions are if you are currently using an insulin pump that has not been approved with the biosimilar product. There are a few of those remaining. So if you are looking for access to Nova Rapid, the brand product, and you're uncertain if your insulin pump has been calibrated for the biosimilar products, that's something that you could speak to your prescriber about, and there may be some support from your prescriber. There is a special authorization process to get an exception for Nova Rapid in those situations. Otherwise, the brand product Nova Rapid and True Rapid, there's a few of the biosimilar products on the market, but they're considered equivalent to each other. So you can move towards the biosimilar products, but you will need a new prescription from your prescriber to do that. It's not interchangeable at the pharmacy level. So the pharmacist may not be able to do that unless they're taking over the prescribing for you of that product. So I hope that helps.
This one question's been answered several times, and I think we're just not seeing that the responses are showing up in the Q&A. So with the Complete Health and the HealthWise RX benefit plans, yes, you are increased at a greater than 80% reimbursement rate for many of the things. The plans associated with those percentage increases also have a higher prescription drug maximum. And to one of Yatin's earlier points, the cost of the products are highly regulated in Alberta, and so the price dispensed or the products dispensed by ARTA or another vendor will cost similar. So that's how we addressed that. And the ARTA in Calgary will be located in the same building that our ARTA office is located. That's the Deerfoot Atria at 6815 8th Street Northeast. It's just off the Deerfoot Trail by the airport.
With that, I think everybody's had a chance to get their questions answered. There's one more coming in. We'll look after that. But I thank you all for taking the time to join us today. I hope the information provided was pertinent for you and that you were able to get your questions answered. If you do have more questions that you think of after the presentation is over, please let us know. Give us a call at 855-444-2782 or send an email to info@arta.net. Thank you all.